Welcome to a critical discussion that I believe will resonate deeply with many of you navigating the complexities of life with diabetes, particularly as you've journeyed past your 40th year. Have you ever paused to consider the silent, yet profound, interplay between managing your blood glucose levels and maintaining your mental serenity? For many of you, the day-to-day reality of living with diabetes is an intricate tapestry woven with regular monitoring, meticulous dietary choices, and often a strict medication regimen. It's a continuous, often demanding, process that extends far beyond mere physiological control, infiltrates your thoughts, influences your emotional landscape, and subtly shapes your overall psychological experience. You might find yourself questioning the impact of this constant vigilance. The precise calibration of insulin doses, the careful selection of every meal, the commitment to regular physical activity. These are not just clinical imperatives. They represent a significant cognitive load, an unrelenting commitment that can feel like a second, often invisible full-time job. And for those of you aged 40 and above, this journey is often layered with additional life responsibilities, perhaps demanding careers, the care of aging parents, or the joys and challenges of raising families. These interwoven pressures can amplify the psychological weight of diabetes management, creating a unique set of stressors that demand our focused attention. Today, our goal is to systematically dissect this often overlooked dimension of diabetes care, the profound connection between your metabolic health and your mental well-being. We're embarking on a comprehensive analysis designed specifically for you to illuminate the intricate pathways through which diabetes can influence your psychological state, and conversely, how your mental health can impact your diabetes management. You see, this isn't a one-way street. It's a bidirectional relationship, a delicate dance where one partner invariably affects the other. As your guide through this exploration, I want to equip you with a deeper, technically informed, yet thoroughly accessible understanding. We'll delve into the underlying mechanisms, moving beyond superficial observations to grasp the fundamental science. For instance, have you ever considered how chronic physiological stress, a common companion to long-term conditions like diabetes, can trigger neuroendocrine responses that directly modulate your mood and cognitive function? Or how persistent inflammation, often present in diabetes, might contribute to changes in brain chemistry, potentially predisposing you to mood disorders. These are not abstract concepts. They're biological realities that impact your daily experience. We will explore how the relentless demands of managing a chronic condition, the constant threat of complications, and the necessary lifestyle adjustments can collectively contribute to mental health disparities within the diabetic population. You might have experienced moments of frustration, anxiety, or even a sense of loss related to your condition. Perhaps you felt the subtle erosion of your sense of control, or the quiet burden of social isolation stemming from dietary restrictions, or the fear of hypoglycemic episodes. These are valid, understandable responses, and it's imperative that we acknowledge and address them with the same rigor we apply to glycemic targets. Our discussion will precisely illuminate the specific factors contributing to these mental health challenges. We will meticulously examine the impact of chronic pain, a prevalent comorbidity in diabetes, and its often underestimated role in exacerbating psychological distress. We'll also critically evaluate how various medication regimens, while essential for metabolic control, can sometimes carry their own psychological side effects, influencing everything from their mood stability to your sleep architecture. And of course, the broader spectrum of lifestyle adjustments, from dietary modifications to exercise prescriptions, will be analyzed not just for their physical benefits, but for their profound psychological implications. Understanding these elements is the first step towards empowering you with a more holistic approach to your health. In our next segment, we will begin to unpack these specific factors in greater detail, starting with the pervasive influence of chronic pain and the intricate ways in which it can compromise your mental resilience. In our previous segment, I promised we would begin to unpack specific factors that profoundly influence your mental well-being when living with diabetes, particularly as you navigate life past your 40th year. Today, we turn our focused attention to one of the most insidious and often underestimated challenges: chronic pain. You might be familiar with the persistent throb, the dull ache, or perhaps the sharp, burning sensation that can accompany various diabetic complications. For many of you, chronic pain isn't just an occasional discomfort. It's a pervasive, often relentless presence that subtly, yet significantly, shapes your daily experience. Consider diabetic neuropathy, for instance, where nerve damage can lead to constant pain in your feet or hands. Or perhaps you contend with diabetic arthropathy, causing stiffness and pain in your joints, or musculoskeletal issues that seem to be exacerbated by your condition. Have you ever found yourself dreading simple activities like walking, or even just standing for extended periods because you anticipate the accompanying discomfort? Does the persistent ache in your lower back, or the burning sensation in your extremities, cast a shadow over moments that should otherwise be enjoyable and stress-free? This isn't merely a physical burden. It's a profound psychological stressor. When your body is in a constant state of alert due to pain signals, your neuroendocrine system responds. This chronic activation of the hypothalamic pituitary adrenal, or HPA axis, leads to sustained elevation of stress hormones like cortisol. This physiological cascade can, over time, directly modulate your mood and cognitive function, contributing to symptoms of anxiety, irritability, and even clinical depression. Your brain isn't just passively receiving pain signals, it's actively interpreting and reacting to them, creating a complex feedback loop where physical discomfort and psychological distress fuel each other in a seemingly unending cycle. Furthermore, chronic pain is a notorious disruptor of sleep architecture. When you are frequently woken by discomfort or find it difficult to achieve restorative sleep due to constant aches, your body and mind are deprived of essential recovery time. Poor sleep, as you may know, is a well-established precursor and amplifier of mood disorders, exacerbating feelings of fatigue, reducing your capacity for coping, and diminishing your overall sense of well-being. This creates a challenging paradox. The pain prevents you from sleeping, and a lack of sleep lowers your pain threshold, making the existing pain feel even more intense and unmanageable. For those of you aged 40 and above, this dynamic often carries additional layers of complexity. The longer duration of diabetes that many of you have experienced increases the likelihood of developing these painful complications. Moreover, you might already be navigating other age-related musculoskeletal conditions or comorbidities, which can be compounded by your diabetes, creating a cumulative burden of physical discomfort. This aggregate effect means that the psychological weight of chronic pain is often amplified, demanding an even greater reserve of mental resilience from you. The chronic inflammation often associated with diabetes, itself a factor in pain perception, can also contribute to neuroinflammation, a biological pathway implicated in depressive symptoms. It's a sophisticated interplay of systems, where one imbalance can trigger a cascade of effects across your entire being. The pervasive influence of chronic pain doesn't just impact your mood. It can also directly interfere with your ability to effectively manage your diabetes. When you're constantly fatigued and distressed by pain, your motivation to adhere to dietary guidelines, engage in regular physical activity, or meticulously monitor your glucose levels can significantly wane. This leads to poor glycemic control, which in turn can further exacerbate nerve damage and inflammatory processes, potentially intensifying your pain and deepening your mental health challenges. It becomes a self-perpetuating cycle that you must consciously work to break. Understanding this intricate relationship is the first critical step toward developing more effective, holistic strategies for your health management. But chronic pain, while significant, is only one piece of this intricate puzzle. As you know, managing diabetes effectively often involves a meticulously planned medication regimen. And here, too, we find another layer of complexity that can profoundly influence your mental well-being. In our next segment, we will meticulously dissect how these essential pharmacological interventions, while vital for metabolic control, can sometimes subtly or even overtly impact your psychological landscape and what you could do to navigate these potential effects. Welcome back. In our previous discussion, we meticulously explored the profound and often insidious impact of chronic pain on your mental well-being when living with diabetes. We dissected how the relentless presence of discomfort can activate your neuroendocrine system, disrupt your sleep, and ultimately erode your psychological resilience. Today, we shift our focus to another critical, yet frequently overlooked, dimension of diabetes management: the intricate world of pharmacological interventions and their often subtle, yet significant, influence on your mental landscape. You understand, perhaps more intimately than most, that medication forms a cornerstone of effective glycemic control. Whether it's insulin, oral hypoglycemic agents, or a combination of various drugs designed to manage blood pressure, cholesterol, or other comorbidities, these are vital tools in your health arsenal. But have you ever paused to consider that while these medications meticulously regulate your physiological processes, they can also subtly, or sometimes not so subtly, modulate your mood, your cognitive function, and your overall emotional state? Let's begin by examining the direct impact of medications specifically targeting your blood glucose. For many of you, the management of insulin or various oral agents demands a constant, almost surgical precision. The timing of doses, their careful titration based on carbohydrate intake or activity levels, and the ever-present awareness of potential side effects, particularly hypoglycemia, constitute a significant cognitive load. Have you experienced that quiet anxiety that lingers before a meal, wondering if your insulin dose is precisely right, or the subtle fear that creeps in during the night, anticipating a hypoglycemic episode? This isn't just a physical risk. It's a psychological burden, a persistent undercurrent of vigilance that can deplete your mental energy and contribute to chronic stress. The physiological response to hypoglycemia itself, the adrenaline surge, the tremors, the confusion, can be deeply unsettling, imprinting a sense of vulnerability that can manifest as heightened anxiety or even panic symptoms over time. Beyond the fear of low blood sugar, the medications themselves can sometimes have direct neurochemical effects. Consider certain classes of drugs used to manage blood pressure, such as beta blockers, which, while crucial for cardiovascular health, can, in some individuals, cross the blood-brain barrier. They can influence neurotransmitter systems, potentially leading to symptoms like fatigue, lethargy, or even a blunting of emotional responses. Similarly, some statins, essential for lipid management, have been anecdotally associated with mood changes or cognitive fog in a subset of patients. While these instances are not universal, and the benefits often far outweigh the risks, it is imperative that you are aware of these potential interactions and discuss any perceived changes with your healthcare provider. Your emotional well-being is as important as your lipid panel. For those of you aged 40 and above, this pharmacological landscape often becomes even more complex. As you progress through life, the likelihood of polypharmacy, the use of multiple medications simultaneously, significantly increases. You might be managing diabetes, hypertension, dyslipidemia, and perhaps other age-related conditions, each with its own prescribed regimen. The sheer logistics of remembering which pill to take at what time, with or without food, and being mindful of potential drug-drug interactions can become an overwhelming mental task. This invisible burden of medication adherence, while critical for your physical health, can paradoxically contribute to feelings of being overwhelmed, a loss of autonomy, or even resentment towards the constant demands of your condition. Have you ever felt that your daily routine is dictated more by your pill schedule than by your personal desires or social engagements? This feeling is valid, and it's a significant, often unacknowledged contributor to psychological distress. Moreover, the cumulative effect of various medications, even those with seemingly benign individual profiles, can create a subtle synergy that impacts your mental state. Liver and kidney function, which can naturally change with age or be affected by diabetes, also play a crucial role in how your body metabolizes and eliminates these drugs. This means that for you, a dose that might be perfectly tolerated by a younger individual could potentially lead to more pronounced or prolonged side effects, including those affecting your mood or cognitive clarity. This demands a highly individualized approach to your treatment, one that not only considers your metabolic targets, but also meticulously evaluates your overall quality of life and mental health. Understanding these pharmacological complexities isn't about fostering distrust in essential treatments. Rather, it's about empowering you with the knowledge to be an active, informed participant in your own care. It's about recognizing that your medications are not just chemical compounds. They're integral components of your daily life that interact with your entire system, including your brain and your emotional core. If you notice persistent changes in your mood, energy levels, sleep patterns, or cognitive function after starting or changing your medication, it is crucial to communicate this openly and candidly with your doctor. These discussions are not complaints. They're vital data points that can lead to adjustments that significantly improve both your physical and mental well-being. But beyond the specific effects of medication, the very act of living with diabetes necessitates a series of profound lifestyle adjustments. These changes, from dietary modifications to exercise regimens, are often portrayed solely in terms of their physical benefits. Yet, their psychological implications are equally, if not more, far-reaching. In our next segment, we will delve into how these essential lifestyle shifts can profoundly reshape your mental landscape, influencing everything from your self-perception to your social interactions, and how you can navigate these changes to foster greater psychological resilience. Welcome back. Our journey through the intricate landscape of diabetes and mental well-being has, so far, meticulously dissected the profound impacts of chronic pain and the often subtle influences of medication regimens on your psychological state. Today, we confront perhaps the most pervasive and personally demanding aspect of diabetes management, the essential, yet psychologically taxing, realm of lifestyle adjustments. You understand intimately that living with diabetes is not merely about taking pills or administering insulin. It fundamentally reconfigures your daily existence, particularly concerning dietary choices and physical activity. Have you ever reflected on how these seemingly straightforward directives, eat healthfully, exercise regularly, translate into a constant, often exhausting cognitive and emotional burden? For many of you past your 40th year, these adjustments aren't just new habits. They represent a significant departure from long-established routines, social norms, and even your self-perception. Consider, for instance, the psychological weight of dietary modifications, the continuous vigilance required to manage carbohydrate intake, the meticulous label reading, the internal calculus of portion control. These are not passive acts. They consume mental energy. Have you felt the quiet sense of deprivation when declining a dessert at a family gathering, or the internal conflict when navigating a restaurant menu, feeling as though your choices are dictated by your condition rather than your preference? This constant negotiation with food can erode spontaneity, foster feelings of guilt or anxiety around eating, and even distort your relationship with what was once a source of comfort or social connection. The very act of eating, for many, becomes an exercise in control and potential risk, rather than simple nourishment or pleasure. This chronic internal negotiation can contribute to significant mental fatigue and, in some cases, even lead to disordered eating patterns or heightened anxiety surrounding meals. Similarly, the imperative for regular physical activity, while undeniably beneficial physiologically, carries its own unique psychological challenges. For those of you who may not have been regularly active prior to your diagnosis, initiating and maintaining an exercise regimen can feel like an insurmountable task. There's the initial discomfort, the potential for self-consciousness, and the struggle to integrate physical activity into an already demanding schedule, often balanced with career responsibilities, family care, and other commitments typical for your age group. Have you ever felt the pressure to perform or the frustration when physical limitations, perhaps exacerbated by diabetic complications, make exercise feel more like a chore than an invigorating activity? The perception of your body, its capabilities, and its limitations can shift dramatically, influencing your self-esteem and body image and contributing to feelings of inadequacy or even shame. These profound lifestyle shifts extend beyond food and exercise. They permeate your social interactions and your sense of identity. The need to explain your dietary restrictions, the reluctance to participate in certain social events due to fear of judgment or difficulty in managing your condition, or the feeling of being different, these are not trivial concerns. They can lead to social isolation, a diminished sense of belonging, and a quiet but persistent feeling of being misunderstood. This emotional labor, the constant work of navigating social situations while managing a chronic illness, adds another layer to your mental burden. However, understanding these challenges is the first step toward transforming them into opportunities for resilience. This leads us to a critical dimension of holistic health management, the proactive cultivation of psychological resilience, and the indispensable role of effective glycemic control in this process. You see, while managing your blood glucose is a physical imperative, its stability profoundly underpins your mental stability. Erratic glycemic fluctuations, particularly episodes of hypoglycemia and hyperglycemia, are not merely physiological events. They are potent neurochemical stressors that can directly trigger symptoms of anxiety, irritability, and cognitive dysfunction. By diligently working towards stable glycemic control, you're not just safeguarding your long-term physical health, you're actively mitigating a significant source of acute psychological distress, creating a more stable neurochemical environment for your brain. This foundational stability allows you to better engage with and benefit from other resilience-building strategies. So, how do you foster this psychological resilience amidst these demands? It begins with self-compassion. Recognize that living with diabetes is an ongoing challenge, and it's okay to have moments of frustration or struggle. It's not a personal failing. It's a complex medical reality. I encourage you to explore evidence-based techniques such as mindfulness meditation, which can help you observe your thoughts and feelings without judgment, fostering a sense of calm and present moment awareness. Cognitive behavioral therapy, CBT, techniques can equip you with strategies to reframe negative thought patterns associated with your condition, transforming feelings of hopelessness into actionable steps. Building a robust support network, whether through family, friends, or diabetes support groups, provides a vital emotional buffer, reminding you that you're not alone in this journey. And crucially, never hesitate to seek professional mental health support. A psychologist or therapist specializing in chronic illness can provide tailored strategies, offering a safe space to process your emotions and develop personalized coping mechanisms. Ultimately, your journey with diabetes is a holistic one, encompassing not just the meticulous management of your physiological parameters, but also the profound nurturing of your mental and emotional well-being. By understanding the intricate connections we've explored today, from chronic pain and medication effect to the psychological impact of lifestyle adjustments, You are empowered to advocate for a more integrated approach to your care. You're not just managing a condition, you are navigating a life. And in this navigation, your mental serenity is as vital as your blood glucose levels. I urge you to engage in open, honest conversations with your healthcare team about all aspects of your well-being, physical, emotional, and social. Your doctors, nurses, and dietitians are partners in this journey, and your candid feedback is invaluable in crafting care plan that truly supports your entire being. Remember, achieving optimal health with diabetes isn't solely about clinical targets. It's about living a full, resilient, and emotionally balanced life, and you possess the agency to shape that reality.